Hi, Wendy.
Hi, Renee. So today we're going to be drawing up a medication out of a vial.
Right. So a vial is different than an ampule. It can be single dose. It can be multi-dose. The institutions try to provide us with single dose vials whenever possible, just from a patient safety point of view, less risk of contamination.
Oh, for sure.
Right? Yeah. So vials are different than ampules in that it can be a larger volume, but not necessarily. But there's a rubber stopper at the end, and there's a cap on there. So the cap has to be flipped off. The manufacturer suggests to clean the top with alcohol.
Okay.
Do that. I've checked my MAR. I know the volume that I have to give, so I select my appropriate syringe. You try to select a syringe that is most close to the volume of medication that you need to administer.
Is there any rule, like can you use any size of syringe, like a 10 cc syringe? Or?
So depending on your purpose, there are some procedures where you need the larger volume syringe because of the pounds per square inch that come out of there. We'll learn about that when we learn about flushing central lines.
Okay. So for medications, then we're probably looking at 1 ml syringes or 3 ml syringe.
Yeah. Exactly. Because if you think about any of the injections you're ever going to give, intramuscular injections, you can inject up to 3 mils into a site, although there's some variability in some of the different literature. Subcutaneous injections can be up to 2 mils. But again, there's some variability in the literature with that as well.
That would be a little red flag for me then if I was going to put in 5 mils of something. I'd say, did I do my math right?
Exactly, right. So we've cleaned our vial. We've, of course, done all of our checks. This is the correct drug for the correct patient, and I know my dose. The thing with a vial is there's a vacuum in there, so you have to inject the same volume of air in before you take your volume of liquid out. Okay? So in this case, I need 1 milliliter. So I have 1 milliliter of air. I'm not using a filter this time because there's no glass.
Okay.
Okay.
So you put 1 ml of air in there?
Yep, and then we invert it.
And I see you're keeping the end of the needle under the level of the fluid there.
The fluid, exactly. Sometimes, if the pressure is high inside that vial, when you inject the air, you'll get a little bit of leakage out. That's okay. I mean, if you're allergic to the medication in there, that's not okay, in which case you would be wearing gloves. Okay, so I have my 1 mil.
If you got a bunch of air in there, can you push it back into the vial?
Definitely, because the system is all closed. Yeah, let me just show you that for a sec. Okay, so you can see that there's air there. I can simply just inject it back and then come and correct my volume here.
Oh, great.
So I'm going to do that. I'm going to scoop cap again. I'm going to double check. All right, and now I'm going to change over my needle. This time this is an intramuscular injection, and my patient is a fair-sized young adult with large muscle mass, so I'm going to actually use a 1.5 inch needle this time. And it definitely has a safety system, and I'm going to put my label on again with 2 patient identifiers, the drug, the dose, what day and time I prepared this, and who, and my initials for sure. Now I'll go to the bedside and administer.
Okay.